Tired of feeling tired? Done with diet culture? Overwhelmed by conflicting nutrition and fitness messages? Then join us, your hosts of the Nutrition Revolution podcast, as we take a deep dive into all things women's fitness and nutrition. I'm Kimberly.
And I'm Tabitha. And together we are debunking diet culture myths and giving you the tools you need to finally see the results you're looking for. All right, listeners, we have a very special episode for you today. We have Katie O'Brien joining us. She is founder-owner of Mindful Midwifery. Did I say that correct? I always want to say midwifery.
So does my husband. He still does.
He still Midwifery.
Yes.
Okay, love it. So, Katie, thank you so much for being here with us.
Absolutely.
We're going to have a lot of great content coming for our listeners that are in the family planning season of life. And even if you're not, you still are a great resource for just women's health in general. But do you want to take a couple minutes and just introduce yourself, let our listeners know who you are, your credentials, like why you're legit and why they should listen to what you have
They should listen to you.
Where they can find you.
Yes. So I've been a midwife since 2007. I knew I wanted to be a midwife pretty quickly in undergrad. So I went for nursing and then straight through to midwifery school. And I've practiced in Baltimore, and then I moved back to Delaware to be around family. And the practices that I've been in have been very diverse. I started out in an all-midwife practice, and we did, very holistic care, water births, all that kind of fun stuff, and then have practiced in more high acuity, high volume settings. So I've really seen the spectrum of women across pregnancy and what that can look like depending upon what you're hoping for, what health concerns you're bringing to the table. And it can look really different, but there are some central themes, I think, of health across the board. And so one of my big priorities as a practitioner is just making sure that I'm meeting people where they're at and merging what they're hoping for versus what might be realistic for them, and kind of getting them on board with what that looks like. So about 2 years ago, I started a business, and it was actually just focused on women's health education initially. And that went well, but dynamics changed in this area, and I felt like I needed to offer a little bit more. So I started with prenatal care and GYN care through that as well. July of 2025.
It's 2025.
I know, crazy. So 2024. And so I'm still on this journey, and I was really excited about your podcast because I love what you have to offer, and I think that traditional medicine doesn't do a great job sometimes of really focusing on nutrition and what that can do for your health and what that can do for your outcomes, and especially in pregnancy, how that can change things. And so it's really wonderful, and I'm going to use this as a resource for my patients. Awesome. And I won't have to do another nutrition segment because this will be it.
So, this is it. I think nutrition in the family planning stage is interesting because there's so much misinformation, right? We're told we're not allowed to eat certain things, or we have to eat this, or we have to do this without knowing really how our body works. I know, for me, taking the prenatal vitamins, I was taking them. Turns out they weren't actually even working for my body because I have MTHFR gene mutation.
Oh, yeah.
So you do? Okay. Both or one?
I actually don't know, so I could go down a long rabbit hole of this diagnosis. But
so it wasn't actually even working for me because I wasn't taking B12.
Yeah,
full. Right. I wasn't. Yeah. It wasn't working. So it's interesting. When you get pregnant, you're like, oh yeah, this is what happens. You get pregnant, you have a baby, done, right? But it's not that simple. Yeah,
and I think that increasingly, because I've been in this industry for a while now, we're getting these segment pieces from TikTok or whatever, and I'm seeing that a lot in labor and delivery because I'm still doing deliveries, not through my practice, but through the hospitals program. And people come in and they have these these 30-second clips that they're putting so much weight on it, and it's frustrating because what that clip might be saying might have, some purpose there, but the context is so much bigger, and they're kind of like seeing the tree instead of the forest with it.
And then they think based off that clip that they're an expert and they understand, they know it all. I think it's one of the downsides to this technological age that we live in, and all this access to social media, is that there's so much misinformation out there that's packaged to be correct. And then also on the flip side of that, so much actual factual rhyming information out there, though, that we can take little snippets and then think that we know it all. We got it figured out, and it can be dangerous for expectations.
Oh, absolutely.
It's hard to find
reality versus expectations.
It's hard to find who do you trust versus who don't you trust, who has the education versus doesn't, because I think a lot of people put out their experience, and what one person's experience is not everyone's experience. So I could say I had a natural delivery, it went great, so I had another one and everything was perfect, so everyone should do it that way. But that's not the case.
Absolutely. And I see that so much, and we already have this undercurrent of mistrust, I think, with obstetric care in this country, which frankly, there's a healthy amount of that. There should be a little bit. We don't have the most spectacular outcomes when we look at the resources that we have. And so there should be a healthy mistrust there. But I think what social media can do is it can really give you these snippets of things that you've decided to put huge priority on that are such a small piece of the picture. And then so when you come in and a provider doesn't respond the way you're hoping because you only have, 5% of the knowledge you need on this, then it just creates this, additional level of mistrust there that is not helpful.
Yeah.
So I like things like this where you really can take the opportunity to break things down further. So there's the whole context, not just this one little piece.
What are you seeing the most right now with your care? What are women wanting or needing or questioning the most with you?
I think that people are doing a better job of trying to find information out for themselves, which is really a positive. And so they want the information. It's just that maybe they're not seeing the whole picture, and they don't really know where to turn to find the whole picture. It's kind of what you were saying a little bit earlier. You have to find somebody that you trust. How do you find somebody you trust? How do you know that their credentials are legit? What's the angle? And there's so many angles that play into childbirth. So many experts, that say, oh, I'm an expert in childbirth. And I don't know, the angle can be narrow. And I also think that people are not talking to, we're not as social as we once were in a larger context. So, people are really removed from delivery, which is also really interesting. When you had these big families, you'd probably see a birth or attend a birth because, you had siblings that would be born after. You'd take care of children because were the whole family unit was really large. But now people can go through their adult life or childhood and adult life having really never been around children, having never really been around pregnant women, having never been around birth, and then they have to learn all of this in a short period of time. And where do they go for that? Because it's not part of the community setting anymore.
That was my husband. Our son was his first ever experience with anything birth. He was the baby of his entire family. And so our son was the first baby that he changed the diaper, had to do all of the things. And he was terrified. So it is, I see where that would happen. And then especially as a female, if that were you as a female, having no exposure to any of this stuff, that would be terrifying.
I think it is. And, I think, that's where we're at right now.
Yeah.
And I, what's really wild to me is it used to be everybody went to Lamaze class. It was just like this. That's what you did. It was a rite of passage. Everybody in the community would be doing it with you. It was a whole thing. And that doesn't exist now. It really doesn't.
Yeah.
And
did you do them?
No, I was pregnant. My babies were born in early 2010 and 2012. So most of my pregnancy was 2009, 2011. And I felt like there were little to no resources available to me other than whatever experiences the women in my life. So my sister-in-laws that had already had a couple kids, my own mother, my mother-in-law, those were the sources, but they were just their experiences, and none of those women are medical professionals or, involved in the world of midwifery. I did go to a birthing class at the hospital with my husband for the first, and really the only thing that I can remember from that is coming away with about the ring of fire.
Yeah.
The baby's crowning and being low-key traumatized.
Right.
Mm-hmm. And literally my husband being like, I can't stop thinking about the ring of fire. I'm like,
did he ask you after? Did you experience it?
It's not you. So yeah, I mean, in hindsight, seeing some of my younger sister-in-laws, because I'm the oldest sibling on my side of the family, and seeing some of them that are currently still having children and family planning, the resources that are available, and
there's so much.
The knowledge that's out there, I'm like low-key kind of jealous.
Yeah.
Like I wish I could get a do-over, but yeah, there wasn't much. It was like you went to your doctor, your OBGYN at these set dates for your checkups while you were pregnant, and maybe if you got lucky and had one with a great bedside manner, they'd like talk to you like a normal person. Otherwise, it was scoot your butt down closer so we can do an exam. Or listen to the baby's heartbeat. Yeah, everything's fine. Weighed you. That was the biggest thing. Like, don't put on too much weight. Don't put on too little weight. And then as we get close to that due date, we'll let you know when you should either come in to be induced, or you'll be one of those women that, goes into labor on your own beforehand. And that was kind of it. Mm-hmm. It's like, I didn't even really know a whole lot of what to expect when I went into the hospital.
Yeah.
So, and I don't know, maybe that was me not searching out.
No, because I
had
had a similar experience where I gave birth in Northern Virginia, and the dynamics in Northern Virginia are very different than Delaware. Like, a lot of the women are career women, like planned out everything this is how it's going to be. So when I went in, they immediately started talking to me about like scheduling C-sections immediately. And I was like, oh no, I want to go natural. I don't want any C-sections. Like this is my birth plan and here's what I want to do. And they were like, we don't really do natural births that often here. And I was like, well, that's what I want to do. And then all of my visits were just like the little tape measure to make sure my belly was growing and a couple ultrasounds. Like, there wasn't really any education factor to it. It was just like check the check box. When I didn't check the check box, they added more ultrasounds. And then when they figured that out, it was back to check the check box. And I think the only thing we ever did was a hospital tour.
Yeah, I think that for a lot of women, the biggest, experience they're going to have with nutrition in pregnancy is don't eat all of this, and here's how much weight we expect you to gain. That's
literally it in a nutshell.
And the weight piece really frustrates me as a provider, because I've been in this long enough to have seen those recommendations change. And you'll see, if you look at the course of care, in the United States over time, the weight recommendations have really changed over time. And, as all things, every time we're like, this is right. This is exactly right. We are perfect in our thoughts right now. But then today, right? And then you'll see, 5-10 years later, things change, things get tweaked. And so it's a really narrow approach of health and nutrition to just talk about weight gain based on a BMI, mind you, not even anything past that. Just this is your BMI. This is what we expect. End of story. And you're either like doing good or you're not doing good on that.
And they really make you feel bad. I gained 8 pounds with Jackson, and they told me I wasn't gaining enough weight, and are you eating? And like, they were concerned. And then I gained 15 pounds with my daughter, and they were like, all right, we need to start slowing your weight gain down, because we only want you to gain like 20
pounds.
20 to 25 pounds. And I'm like, okay, based off BMI. Like that's what they want. And I was like, oh my gosh, like what? And then you start panicking because you're like, I'm going to gain too much weight. Where like my mom gained 50 pounds with my sister. Her fifth child gained 50 pounds. She was just exhausted. She's like, I just sat on the couch. I was tired, and then lost it all. So like she was like, don't worry about the weight. It's not.
As a provider, it's definitely something that I don't focus as much on.
But what about like gestational diabetes?
Well, sure. I mean, I think we can go into that in a few and launch hard in that, because that's a whole separate topic. But I do want to say that in my training, actually, so it was really early on, I was at a birth center that was an inner city birth center. And what was flooring to me was I do diet recall on these women. And sometimes they had gained weight, sometimes they hadn't. But what was so interesting was their food choices were sometimes horrible. I remember talking to this one young woman, and I was like, okay, well, what have you eaten in the last 24 hours? And part of what she told me she had eaten was 3 candy bars. And I was like, okay, what size are these? Are these like fun size? No, they were full size candy bars. Okay. And then you compare this when I've been in other practices that have been extraordinarily mindful on what they're eating. You do a 24-hour recall and it's flawless on their diet. I'm like, oh my God, you are like pristine, and they're gaining a lot of weight. And I'm like, am I really going to tell this person that has this absolutely wonderful diet that they are doing horrible things because they're gaining too much by our standards versus somebody that's eating 3 candy bars a day, but coming in not gaining a lot of weight? Like that is a horribly limited view on this.
Yeah. Well, and I feel like there's this, okay, so when I was in my pregnancy years, you're a human garbage disposal during prepregnancy, right? Like you can eat everything. Eat all the things you're eating for 2. What is the baby craving? First of all, the baby is craving nothing, by the way. And it was just like, I remember I did through both of my pregnancies, I did my Friday Dunkin' Donuts, and I would go and get 2 donuts, a glazed and a chocolate frosted. During the winter months, sometimes throw in a hot cocoa on that. And it was like, oh, I'm pregnant. I can do this, right? Like not even, and this was obviously well before I was as well versed as I am. I hadn't gone through my formal education with nutrition to understand nutrition through the life cycle and all of that. But it was just that like ethos of like human garbage disposal, literally, like just an excuse to just eat trash food, junk foods, all those high processed,
thinking about the processed foods effects on the fetus.
I'm going to be gaining weight anyways, so might as well have fun with it versus what are the nutrients that my baby and my body needs, and how are things changing and shifting, and how can I support myself in this pregnancy for the best possible outcomes, during the prenatal and the postnatal and my recovery. And I don't know if that has, I'm so far removed. I have a 13 and 15-year-old, so I'm so far removed from the baby world and pregnancy. I don't know if that's changed in recent years where there's more awareness, but that's what I felt like my experience and the women around me, that was their experiences.
I think there's extremism actually now, and I'd really like to see it become a little bit more moderate, which is another thing I like about your podcast in general, because I think, you address that a little bit. But it's like people can become really obsessive about what they're eating.
That was me.
Which I don't think is ideal. One, we're humans, so
I was terrified to give in to an ice cream craving. Yeah. Like I wouldn't eat anything off plan. Wow.
Yes. Girl, I was eating ice cream for you.
So was my husband.
I was still also eating like nutrient dense foods, like good meals and stuff. But like if I wanted to indulge, I was
paleo, and I would not diverge from that. I wanted a clown sundae from Friendly's. Do you know what that is?
I do not.
Okay, it's like a scoop of vanilla ice cream in a cup, and then the vanilla like cream for the ears, and then a sundae, like a cone dipped in chocolate, and then Reese's Pieces. I wanted one so bad. And I wouldn't let myself have one. That's how strict I was. So, 2 extremes here.
Exactly. Yeah. And
you need to find a middle line.
You've got to find a middle line. I think that
extremism is not the cure for extremism.
No.
It's one of my favorite quotes.
Yes, it's true.
Yes. And then there are middle lines, and we do have some recommendations that are solid. And I don't like to get hung up in the absolute, make sure it's 25 to 35 pounds. And, there's too many factors there for me. But, I think you should be striving to eat healthy. And, a lot of women worry about, well, can I eat this? Can I eat that? Honestly, most of the stuff is just basic food safety, but it's more important to follow. That's what I tell people. It's like
the deli meat.
Exactly. Is deli meat ever really healthy for you? No. Right?
Right.
But is it this, toxic trash that if you have a sub or a turkey sandwich that you're going to drastically harm yourself? Again, that balance.
It's a balance. And listeria, the other interesting thing, because that's where some of this stuff is geared towards your listeria risk, right? But you can get listeria from spinach. So once again, food safety, with deli meats, really you should be heating it ideally. So if you're, getting something that's been heated, that's going to be fine. Now we could once again talk about how much deli meat you really should be eating in the pregnancy, but
and food safety in general.
Yeah,
everything you eat, you're at risk now. My son he ate bread and got E. coli.
That's the thing. That's why
you just don't
feel
know.
like you
Right.
can't be
There's no
so
blanketed
obsessive
statement
about
of-
that, right? But
To that point, though, I've also lived my entire life, 40 years, eating food, and I've never had severe food poisoning, sickness. Like I think maybe one time I've had actual food poisoning. So there are those instances where you can get sick, but then I feel like in general, if you practice food safety,
Exactly.
like you're going to be fine. So I don't want like, you know, our listeners to like
Panic.
freak out.
Yeah.
Start
No,
panicking.
I don't either. I always joke, I'm like, don't go to Mexico and then eat
Yeah,
the queso
there you
that's been
go.
there. Okay, because
or drink the water from the tap,
Right,
from
like
the faucet.
that's going to be more problematic. The times I've seen people get like food, you know, borne illness, it's things that are just not good and accidental most of the time. So like I remember this one patient came in really sick, and her husband had taken out lunch meat that sat on the counter unknowingly to her for like over 12 hours. I think it was like the next day she ate it. Well, would anybody like do that consciously?
No.
Right.
So
Right.
of course she got sick.
Yeah.
You know, baby was fine, but you know, the point is most of the time that's what you're going to see is blatantly not great planned.
Yeah.
One of the interesting things about sushi is I remember reading a number of years ago that when they've genetically tested fish to see what type of fish they are, it's often not the type of fish that
You
it's
think
being
it is?
advertised as, and that's across all like grocery stores, all level restaurants. It's not like it's not a problem that's just from bad practices on like the establishment's part. It's before that, and so I think, you know, when it comes to like avoiding raw, you know, sushi, some of that is just that, you know, do we know exactly what we're getting, and is that a problematic fish to start with, and are you going to be more influenced while you're pregnant than when you're not? And the answer is yes, you're going to be more influenced because of being immunocompromised. Beyond, you know, regular everyday food practices, I think that for the most part you can eat what you want. I mean, I was not paranoid in pregnancy myself, and I was a midwife first, so
Yeah.
Yeah, I wasn't paranoid either during my pregnancies. I kind of just tried to like make smart choices, enjoyed it, definitely overindulged. And that's my personality.
Yeah.
You know, I think that personality does play a part in that. Okay, so backing up a minute, for our listeners that are in the family planning stage and want to know about maybe not so much what not to eat, because I feel like you hear that information everywhere.
Right. Yeah.
But I remember when I started my master's several years ago, my very first class was Nutrition Through the Life Cycle. And it started with the pre-pregnancy planning and nutrition, and then into pregnancy. And one of the things that blew my mind, and you'll have to fact check this, but was this idea that during pregnancy, the body shifts and gives all of the nutrients to the baby first and the mother last. And what I learned in this class was that's actually incorrect. That the mother's body, so when you're talking about like vitamins and minerals and the macros, the mother's body will get what it needs first, and then the developing fetus baby will have access to the nutrients or the things that are left over. So this whole idea that, you know, oh, it doesn't matter, like the baby's like a little leech sucking everything out of you, the mother's body still is going to be taken care of first as sort of like the host. What would you say to that?
That's
what's your
interesting.
knowledge
I haven't
base?
thought about it. I haven't come across that language in a while, actually, like all or nothing. I think it's actually probably a little bit more nuanced than that, because different things cross the placenta in different ways. So I know that some, you know, minerals are going to be more easily absorbed than others. And I don't know that that thought process has a lot of weight to it, really. I mean, I think you have to look at each individual thing and what do you need for that, and, you know, are you even deficient to start with? One of the things I really like to focus on that is controversial, actually. It's kind of funny to me that it is, but is vitamin D. I mean, there are some sources that say vitamin D doesn't matter at all in pregnancy, and then other sources that would tell you it's hugely impactful. And then what, you know, they feel that where your levels should be are different. I personally am in the mindset that it's very important and that your levels should be higher than what they even more of a naturopathic high, you know how there's the different levels between the sources. I tend to favor the 60 to 100, level serum wise.
So like if you're on the low end, but within normal, so normal, but low, that's still too low.
For me.
Is that, what you're saying? No, I agree with you. A lot of the times with looking at like the content of your serum vitamin mineral levels, you can be within normal and your doctor will be like, oh, you're normal, but you're like you're like right on the line
right
within normal. So you're so low, but it's still, you can experience the deficiency, the side effects of deficiency where it's too low.
Right. And I think that's one thing that one of the really good examples that obstetrics has not really come into a consensus on. And I haven't found anything that has said that when you are at these higher levels with vitamin D that it's harmful. And there have been some studies that have looked at, harm to mom, harm to baby if you are taking higher supplements. And I just haven't seen anything negative. So that's part of my thought process on this, is if it can be helpful, then why avoid it? The other one that comes into my mind very easily about a sort of like, just blanket statement of what you need is iron. Iron's often in prenatal vitamins, but you don't always need that. And if you don't need it, it's very constipating.
Yes. So I run the risk of anemia very easily, so I have to be very careful about my iron intake. And I cannot take iron supplements because it makes me so constipated. It hurts my stomach. During that menstrual phase, I am like red meat, like get as much of it in as I can, because I feel like that works better than any supplementation. So
absolutely. I mean, supplements can only get you so far. You really have to have it in your base diet as well, especially for some of them to even work. But in the first trimester, a lot of women get very nauseous. So one of the first things that I'll say to them is, do your prenatal vitamins have iron in them? Because we test your CBC at the start of pregnancy. So we know whether or not you need iron based on that level. And what's also interesting is some people have, conditions like hematomicrosis, which are going to be too high of iron. So we're just blanket giving people iron that might not, it's actually not even good for them.
Right. Too much iron is not a good thing.
Right. So I do think there's, that you really need to kind of pull apart it a little bit more than that. And sometimes taking, people off of prenatal vitamins with iron, because there are ones that are without iron, can really help them. So
can help with the nausea?
Help with the nausea, help with the constipation, just make it easier to even take, I think. And then we check again for iron levels at 20, indirectly iron levels, because we're testing your hemoglobin and hematocrit. But we test again for that in the middle of pregnancy. It was 28 weeks. So, really...
You're going to get that retest.
You're going to get that retested. So... And there is no, perfect prenatal vitamin, by the way.
That's what I'm going to ask. With Jackson, I just took whatever over-the-counter Nature's Made. I don't even know.
I just did over-the-counter.
With Finley, I went off blood work and did it because I was working with a midwife, and she had me do blood work. And then was like, you need this, and you need this, and you need this. So I was doing tinctures and supplementing that way. And it was nothing. There was no just bottle of one thing. And I felt better.
Yeah, I'm sure. So, I mean, I think if you are, paying attention to it and I mean, on some level, deep diving it. That's a bit of a deep dive.
But I like that.
Welcome to my life.
Yes. The idea of a personalized prenatal approach.
Right, absolutely.
It felt
versus
better.
the one size fits all.
Headaches. I wasn't getting, with Jackson, I remember I would stand up and feel like I was dizzy if I stood too long. I was teaching. And so sometimes I'd be like, oh my gosh, I got to sit down. I didn't have a lot of the symptoms that I had with Jackson that I did with Finley. I felt so much healthier with Finley during that pregnancy because I was taking what I needed for my actual blood work for my body, what was actually lacking.
What your body needed. Another great example is magnesium. I mean, magnesium has so many uses, but if you are taking it, too quickly, you can become hypotensive and then you're feeling terrible, so.
Hypotensive, for listeners, low blood pressure.
Oh, sorry. Yes.
That's okay. Yeah.
So, they all have, this could be hours that we could go over each individual thing and the pros and cons of it.
Yeah.
But I do think, so if somebody's out there, really struggling with nausea, especially, or constipation, I would bring your prenatal to your provider and see, is this, do I need all of these things that are in this? You know, can I individually supplement instead? Yeah. I think that's always worth the conversation, as opposed to, I think it's easy to just go off of all supplements entirely. And I don't know that that's always a great plan either. I mean, maybe if you have a very healthy diet, but there are some things like, let's say you have MTHFR, then you need supplementation. Yeah. Like even when you're not pregnant, right?
You need the real folate.
Right. You need that your whole life. And I also like to look at pregnancy and pre-pregnancy as a time of starting to understand general health for your life moving forward. It's a really great time to assess wellness. And it can be very motivating for people. Like when you look at people trying to quit cigarettes, well, pregnancy is, you know, they have this extra motivator to do it. And so it's a great time to kind of be motivated, if you can be, by this experience and start, you know, adjusting your life. Like people that have gestational diabetes, I like to tell them, you know, after they're pregnant, okay, well, guess what? We're not going to test anymore. You don't, you know, we're not worried you have gestational diabetes anymore. However, you know, people with gestational diabetes are more likely to have diabetes later in life. And so these things that you learned while you're pregnant, things that are good for your body, things that are not good for your body, probably still apply to some extent. Yeah. And keep going. Right. Exactly. Yeah. Don't just like go back to a horrible eating habit.
Yeah. Especially because now you're raising a child who is going to watch what you're doing and see what you're doing. And you want to set them up for success too. So
absolutely.
I quit drinking with the moment I found out I was pregnant. I haven't really drank since Jackson, and just kind of use that as a catalyst of like, well, what do I want for him in the future? Like, do I want him to see me drinking? And, you know, it was like, no, and I don't really need it. So I'm fine. So that is a good way to put it too. It's like kind of like a catalyst to
yeah. It's a great opportunity to take stock and inventory of where you are, where you want to be, and then an opportunity to like make those changes for good reason, where you can be like, oh, well, I'm pregnant, and then I'm going to have this whole human to raise, where it kind of gives you that catalyst, that excuse, right? Not excuse, but that drive to really make those changes. So we've talked about vitamin D and iron and a little bit of magnesium. For our listeners that either struggle with the side effects of the prenatal vitamins, or maybe just aren't huge on them, or even if they are, like what whole real foods would you recommend that women that are planning for pregnancy and or pregnant should focus on?
So I personally think that most of what you need to do pre-pregnant is what's good anyway. I mean, when I do preconception visits, which by the way, I wish more people did. The kind of interesting thing about preconception visits is the people that tend to do them, which my guess is a lot of your listeners might be some of them, are already on this great wellness journey. And so you're like, you're already doing so great. Why can't I get these people that are not doing so great?
It's the ones who aren't coming that need to come.
Exactly.
Do you think it's part two that there's just not enough education or awareness around it? Because I think, I mean, my whole life it was like, don't get pregnant, don't get pregnant, don't get pregnant. And then when you do try to get pregnant, it's like, oh, this is actually isn't as easy as like I thought it was. Like you know, so I think that people think like, all right, I'm not going to, I'm going to go on birth control and I'm not going to get pregnant. And then when I do want to get pregnant, I'll just come off of birth control and I'll get pregnant.
Absolutely.
So they don't even think that pre-planning is a resource or a thing that they should do unless they're having issues conceiving.
Right. Yeah. I think that we live in this culture of women that are successful, right? Of this goal-oriented culture, which in a lot of ways is very good. But what you see in pregnancy is kind of exactly what you just said. It's like, okay, I'm used to preparing for a test, studying really hard, taking a test, getting an A, succeeding. Great. Awesome. I'm going to do the same thing with pregnancy. I'm going to go off my birth control right now, and I've done all the things, and I'm just immediately going to get pregnant because, hey, I did everything right? And it doesn't always happen that way. And then I think our sense of time is also really warped now. I probably could blame social media for that, where, you know, if you haven't gotten pregnant by month 2, it's like, oh my God, something's wrong.
Yeah.
You know, well, by practitioner standards, we don't consider anything even interesting until you get to a year.
Right.
With some exceptions. If you have like polycystic ovarian syndrome, then a whole different thing. But like, let's say you don't have any diagnoses going in, you've just had normal cycles, everything's been very normal. Like, we don't consider that unusual until you hit a year.
So I'd like to blame Amazon for the instant gratification culture that we're in, because I can literally get everything, and grocery delivery. Like, put my grocery order in last night. They're going to be delivered here in the next hour.
Yeah.
Amazon, you can get same day delivery. Information's right there at our fingertips. So I can appreciate how that could be a struggle or a challenge facing modern day women that are family planning. Like,
we're used to like just, right here, right now.
Yeah.
Let's just do it. And
what do you mean I have to wait? What do you mean?
Right.
And I don't think the education in schools, you know, or even at home has prepared us for, one, that it can take a little bit to get pregnant. 2, I mean, almost every woman in my family had a miscarriage.
Miscarriages are very common, very common.
And also, and this is a different topic, but like, as you get older, you know, just because you do, you know, oh, I want to have a baby at 37, like you really are running out of time. Like, you have to plan that. But I think that people are like, oh, well, I'll just freeze my eggs and then I'll just get pregnant when I want to. Like, that also, I think people think that's going to be like, IVF is a safe, easy way to do it. Everyone gets pregnant through IVF. Like, I don't think the world has done anyone justice of saying that could also not work, especially as you get older.
I think there's that snippet problem again, because when you look at freezing eggs, okay, and unless this has changed recently, the ideal age they used to consider freezing eggs is like 32.
Right.
And the reason is not that you can't get perfectly great eggs after that. But you know, you want to do it in a time where everything's still great, and they feel like, okay, well, by 32, if you haven't gotten pregnant yet, you've given it some time, right? And so maybe you're a career person and you want to delay it. If you have good eggs, it makes the whole process go a lot easier. But if all you are thinking about is, oh, I just need to retrieve my eggs without any context on that, you could be saying to yourself, we'll just do that at 38 years old.
Yeah.
Okay, well, that's... By 40, I think it's around 40, they don't even want you to use your own eggs anymore if you're doing IVF. So you really have to find that out, you know, and not just be, like you said, reassured essentially by this idea that I'll just do this later. It won't be that difficult.
Yeah, I think the education portion on pregnancy and how to get pregnant and how to stay pregnant, like it's very eye-opening how little information there is out there.
And I'm sure you both could speak on cortisol a lot, but I just have this theory that, you know, when you get into this, I need to get pregnant, and you, like, on month 2 are already freaking out that you haven't gotten pregnant, I think that your body's actually going to start working against you because your anxiety is so high.
Heightened stress.
Yeah.
I just had this conversation with a client, like, maybe go on vacation and relax and don't think about it. And, you know, easier said than done. But
I would say it's
sometimes
hard. The heart wants what the heart wants. Yeah. So my husband and I have dealt with secondary infertility. We had our two children, our daughter and our son, really, really easily. Like, I literally, with our daughter, was one of those women, like, I had been on the pill for years, got married, you know, stayed on the pill till we were ready to be parents, got off the pill, boom, that first month off, I was pregnant. Like, wow, mind blown, right?
Yeah.
Flawless pregnancies. My son, I never went back on the pill after I had my daughter. My kids are just under 2 years apart. So took, like, I think 3 or 4 months. No big deal. Then, you know, a little over a year later, we're like, all right, baby number 3, you want to start planning for that? I had gone back on the birth control pill after my son, got off that, kind of expected a very similar, like, this should be a done deal in the first, like, 4 to 6 months. And 2 years later, nothing. And the secondary infertility actually was male factor. So that's a whole thing. We went through this whole journey, Penn Fertility, seeing the male fertility specialist, like, all of this. But it's really heartbreaking, and it can become all consuming. And I lived that. Even already having children, like, it took over my life.
Yeah, it's devastating.
Every thought, every second of every day. Am I going to get pregnant? When am I going to get pregnant? What does this look like? And so it it's so much easier. And when people would tell me like, oh, relax, you already have kids. That was
That's not the answer.
It was just, it's really hard. And I chuckle, but it's not funny. And it's so much easier said than done to just go with the flow, especially when you're a type A planner like myself, like I was like, okay, this is not okay.
But your body really does hold on to that. Like you're in flight mode, right? Like now you're, tensed up and paranoid and your hormones are changing and you just cannot relax enough to allow that to happen. I've had lots of friends who like, oh, we're just going to go adopt. And then they get pregnant because they're like, we closed that chapter, but now we're pregnant. And it's like, your body's finally like, oh, I can relax. Like I've made a choice and I'm moving on. And then once your body relaxes, then it happens. Not for everyone, but it is something I hear pretty common.
Yeah, it's something we see pretty commonly. And I think what's really important to keep in mind, and it's kind of a blanket approach to preconception in general, is you have to realize that pregnancy is a stressor on your body, and your body knows that. So and we are evolutionarily fit to be able to survive, right? Like that's how our body functions.
Yeah, there's checks and balances for all those natural stresses.
So your body is going to be like, this, for whatever these things are, this is too much of a stress. I'm not going to do it. Like not just, I'm saying if you're like trying to get pregnant, but just stressors, if you think about it more broadly, like in general, it's a stressor and you have to, if you're going to be trying to control it at all, just look at, okay, if my body is thinking that pregnancy is a stressor because it is, what is happening here in my body that maybe is too much for it? I think like when you look at activity level, weight, all of those things, chronic illness is a huge stressor. So to add another stressor to that, your body is not going to want to do that necessarily. So that's where I just keep coming back to its general wellness concepts. It's not really some key to this all that's hard, that's abstract. It's really, what does general wellness look like? And are you fitting that? And if you are fitting that, and there's not much, you look at your list, well, I'm eating healthy and you know what, I'm exercising and I'm a normal weight and I don't have any chronic conditions and, it's been a year and I haven't gotten pregnant. Well, then you really need to not put so much pressure on yourself that there's something you can do about this yourself, and that's when I would really go see someone, And one of the things that I think that we don't talk enough about is that it could be male related. And I think there's always this assumption immediately that it's the woman.
Yes, always.
I've seen so many women going through all of the work and then a year later finding out, oh, it wasn't actually, I've been doing all of this stuff and it's actually not been me.
So fortunately, in my experience with our infertility journey, my OBGYN was really fantastic with this. So after we had been trying for a little over a year, I finally was like, I'm going to go see somebody, even though I'd had regular cycles. So I didn't think that there was something really serious going on. I thought there was a possibility the doctor would tell me, take your time. You're maybe, stressing out. But I was like, well, let me just go and see. So I went to my doctor. He ordered blood work on me. Everything came back normal. And he actually said, I'm not going to run another test on you or do anything else until we see what's going on with your husband. And then that added up. Like I said, ours was a male factor infertility issue. And so I'm grateful for that because I think it saved me a lot of stress and angst. And then in, I guess, other ways opened up a whole nother can of worms. I was like, oh, shoot, I didn't even think that there could potentially be the issue could be there because he's the father of my only 2 children. And so, you just assume like if a man has fathered one, like that clearly it must be me. But that is, I am grateful for that experience that at least like didn't send me down this rabbit hole of all this testing and everything and was like, nope, okay, initially snapshot, you're still within the childbearing years, you're healthy. I checked all those boxes. Like, let's look at what else is going on. So you've mentioned a few times about like general wellness. I would like you to dive in for our listeners, because that's kind of like vague and very broad. Like, what are some specific general wellness tools or habits that our listeners that are family planning could implement or work on to help improve positive outcomes with pregnancy?
Yeah. So exercise, which I'd love to go more into that in a little bit with you on exercise.
Let's do that now.
Okay.
Yeah, let's just do it now. So exercise.
Yeah. Yes. And these are regular exercise recommendations. This isn't anything specific to preconception. So, if you had somebody coming to you and they were like, I'm going to get pregnant, what would be your, recommendations on that? What would you tell people?
Get up and get your body. Move your body. So would you say that if you have a woman who is already well-conditioned, already exercises a lot, would you say that it is safe for her to continue exercising in her throughout pregnancy?
I just read an article on heavy weightlifting in pregnancy, which was really interesting to me. I think it was NIH. But they were looking at, we have universally said that if you're heavy lifting, that's something you shouldn't be doing in pregnancy. But it's actually been anecdotal. It hasn't been evidence-based. And so this was looking at Olympic athletes and their outcomes. And they looked pretty similar. One of the concerns they had was pelvic floor.
But if you know how to breathe and work with your pelvic floor muscles,
a lot of these Olympic athletes or CrossFit, elite athletes, they know how to breathe for their body. They're doing all of that.
And that applies when you're not
mobility
pregnant,
before.
not pregnant. You need to learn how to lift to support your pelvic floor muscles.
Yeah.
And that was actually stated in this that, it matters very much how you are lifting in that context. And so I think that was a pretty big moment for me because I was like, oh, this is another example of how we thought we knew everything. And here it is. I mean, I think that was published in 2024. Here it is that maybe that's not true. Maybe heavy lifting is perfectly fine and maybe even good in pregnancy.
I kept lifting. Did you keep lifting?
Oh, I taught spin class and a strength training class on my due date with both of my children.
Yeah.
And I literally had members at the gym that were in the 60 plus crowd at the time come up to me and chastise me.
Yeah.
That I was going to do harm to my baby.
You're going to rip the placenta.
Does your doctor know you're doing this? And I was like, yeah, actually my doctor's been a really big advocate for my healthy, active pregnancy, and anything that I was already doing and conditioned for before I got pregnant, it was safe to continue. And I had to obviously modify along the way, right? With a growing abdomen, your center of gravity shifts. So you have to be a little safer, smarter, less balance work, that kind of thing. I wasn't going to lay on my stomach and do Supermans.
Yeah.
Right. So I changed some of that, and the intensity I probably pulled back a little bit from, but I feel like I had very healthy, robust pregnancies as a result of being a healthy, strong, robust woman that continued to exercise. I think that my delivery and recovery were good. Were supported through that exercise. So I would say that if you are a couch potato and then you get pregnant, no, that's not the time to all of a sudden go lift some heavy weight. And, you're going to maybe need to start with body weight, get up and walk and move. So meet yourself where you are. But for those listeners that are already well conditioned, girlfriend, keep rolling, keep doing it. You're going to have better outcomes from what I've studied during your pregnancy and then postnatal as well for your own recovery. And I have read, Katie fact check me, but I have read some evidence that in conditioned women that continue to stay active and lift weights and engage in cardio and work out through their pregnancies, that they have healthier, stronger infants.
That was part of what this was
higher birth weights, better APGAR scores. And I will say both of my babies were very robust and healthy. And my daughter had severe meconium aspiration syndrome, but I was 11 days overdue. And so I don't know if that's played a part in it. Yeah, where she swallowed the meconium.
Yeah, that's
but she was, I remember the neonatologist, she was taken up to Christiana, to the NICU up there, because I delivered at Bay Health Kent, which was Kent General then. And they were like, she's our little star. She's so strong. She was full term, she was 8 pounds, 9 ounces, like big, healthy baby, like recovered as well as could be from really what was a very precarious situation where initially they were talking to us about like head cooling and not knowing about like brain damage and this like very terrifying things for a new mom. But the outcomes, and I believe, and this is purely anecdotal, I have no evidence, but I believe that my active pregnancy, despite my Dunkin' Donuts obsession, my active pregnancy and my trying to eat nutrient-dense foods as much as possible created a baby that was very healthy and robust and able to like bounce back from kind of a traumatic entry into this world. Anyways, that's just my personal experience. I'm a big advocate of any clients that I've ever had that are family planning or pregnant, like, if you've been doing it, keep doing it. And that's what I read are, you know, best
I think that's
practices.
kind of what we're taught to when we're doing personal training. And that's what I've always practiced with my clients too. Like if you lifted when you were, before you got pregnant, well before, not like a week before, but like, if your body is used to doing those things, keep doing them. And I've seen great success with like stronger deliveries and healthy babies and
moms that are able to bounce back
so quick.
Recover. Like I felt like my recovery, granted I was in my 20s, so that helps, but I feel like my physical strength and ability to recover was adequate, was good.
Yeah, I agree with all of that. I think so big take homes. Stuff on your back is, you know, problematic, like
for sure, anything that puts pressure on the baby.
And that's the whole, like, as your baby
not
grows,
right away, but like 20
you have to
weeks,
make, modifications to those exercises.
And then, if you weren't a marathon runner before, you're not going to become a marathon runner during pregnancy.
Be smart. Training. Smart. Be smart about it.
So exercise.
So let's see, healthy diet, which we've kind of touched on.
What do you think that would like?
I think that looks like what you guys have been talking about in all your podcasts so far. You know,
so a nice healthy balance between clean, whole foods,
nutrient dense.
Yes, and I think that protein's really important, which I know you have. I think you have a whole episode on protein.
Protein.
2 episodes on protein.
Right.
Big deal.
So it's a big deal in pregnancy. So that's important. I think baseline health screenings are important. I don't think that you need to go and have a whole, deep dive initially on hormones and all that kind of stuff. But, sit down with a provider and see if you're anemic, see if you have thyroid problems, even if they're low grade. Once again, this is adding to your body's understanding of being stressed, and see what your vitamin D level is. If that's not, once again, I would say like 60 is ideal, but especially if it's even by normal standards low, you want to address that. And I would say mental well-being is also really important. So coping mechanisms, if you already struggle with anxiety, pregnancy is not going to help that. Neither is postpartum, and neither is child rearing. Like these are not conditions that just, this gets better inherently necessarily.
Babies don't fix everything.
I know. It's surprising.
Shocking.
Okay, I love my children more than life, more than words. They make life harder.
Yeah.
Point blank.
Especially when your hormones are off.
Worth it. Like before you all cancel me and come for me. Worth it. But yeah. Having children fixes nothing.
Right. I remember very, very clearly my pediatric nurse practitioner saying to me early on, I think it was in the first 6 weeks, babies, people think that babies will help marriage problems, but in fact, they amplify anything that already existed in that relationship. And I think that's really true. So is your relationship, on solid ground? Because if it's not, is that actually influencing things? Should you be, going to a counselor and trying to, help that? Like, just general mental wellness, like that needs to be part of the conversation too, because you need these coping mechanisms to deal with what's going to come through the pregnancy as well. Same thing. With all of it, it's like you if you start preconception on these things, it's just going to create a better pregnancy, a greater postpartum, and even a child rearing experience. So doing that then. So health screenings, think those are the big ones, really. If you've had normal periods, if you've had a really normal reproductive life thus far, chances are it's going to be fine, but I think also I'm always a huge fan of going into things thinking about, okay, well, if things don't go well, how can I live with myself, right? And so if you went into this and you've fixed your exercise routine and your health, and you went and got checkups and you made sure, everything was good. And then if you had a little bit of time and you didn't get pregnant, making sure, it's not a male problem. When you get later on, you've already done all of that. You can say to yourself, I already did all of that, and I can feel good about this that I did, and know that now I need to seek help and feel reassured about that because you already had a good starting place, a good foundation. Not that you can, like, something that you can say, oh, if only. I hate the if onlys. They can really wreak havoc.
I think all of this information has been incredibly helpful. I know we could go on for hours and hours about all these little pieces of, what to do. But I think that the big takeaway here is that don't panic if you don't get pregnant right away.
Right.
Pay attention to what you're eating, pay attention to, what you're taking supplement wise, and get some blood work done and figure out what you actually need. Move your body. And then, I guess if you still aren't having success with getting pregnant, that's when you would go find someone to talk to.
Right. I wouldn't wait years to do that, And if you do have anything, if your cycles haven't been normal, you have PCOS, then I think it warrants something earlier than a year, for anybody.
Even before you're planning.
Right. Absolutely. That's part of my conversation with people that do have problems is, don't wait till that year because we already know you're going to be in a difficult state. Mm-hmm. So let's, cut to the chase a little bit earlier with that. Yeah.
Good.
Well, so would you say, in a nutshell, if it ain't broke, don't fix it, or don't reinvent the wheel? So for our listeners that are maybe obsessing over like all the supplements they need to take and doing all the right things, would you encourage them to instead get back to the basics? Focus on a nutrient-dense, whole foods diet as much as possible, knowing that we're going to throw some Dunkin' Donuts in there, girlfriend, every now and then, right? Right. It's life. You got to live it and enjoy it.
Sunday.
Yeah, eat the clown sundae. Movement. Either start moving and meet yourself where you are, or keep moving, and then focus on like stress management and overall wellness. Like those are the three foundational: solid, nutrient-dense diet, regular physical activity, get your mind right.
And I think enjoy the journey if you can. It is a journey. And, I think sometimes we focus so much on the outcome, and it's so easy to do with pregnancy because there's your grade, there's your A, right? Yeah. You just did it. But some of it is also the journey. And if you can focus on, the good things about it, like getting healthier if you need to, or just, giving yourself time or enjoying that new part of your relationship, whatever it is, try to stay in the moment as much as you can with it.
I love that.
Love that. Yeah. Thank you so much. Listeners, stay tuned for part 2. We'll be back with Katie to talk about gestational diabetes and some of the management of that condition.
Yep.
Sounds good. Thanks.
Thanks for spending your time with us. If you found this podcast helpful, we would love for you to share it with your friends and family. And don't forget to subscribe on your podcast platform. If you have nutrition or fitness questions you want answered on future episodes, we would love to hear from you. You can submit these questions to our email, thenutritionrevolutionpodcast@gmail.com, and follow us on Instagram @thenutritionrevolutionpodcast.